And all across the Madison area, families are gearing up for Thanksgiving.
This year, there are 2 additional viruses going around, RSV that we've talked so much about, and the flu. So it's extra important that you stay healthy.
UW Health's Dr. Jeff Pothof is back with us with some timely advice. Good to see you again, Doctor.
Good to see you, too.
I noticed you were shaking your head during that drug shortage story. That's a big problem.
That is a problem, and we're seeing it right now with some of these medications that we would use for influenza, Tamiflu, some antibiotics that we use for bacterial infections, but it seems every so often we do run into these medication shortages, sometimes because we haven't produced enough. In this case, demand is higher than expected.
What does that tell you? Does that tell you that all the talk we've been having about the triple-demic, is that coming true?
Certainly as it relates to influenza. We thought that this year would be a pretty bad influenza year, and it looks like we're holding true to that initial assumption. Not as much in Wisconsin. We're certainly gone from low to moderate levels. We're seeing more cases of influenza, but when you look certainly in the south, kind of all the way to Texas, numbers are really high for influenza.
Let's talk about the COVID vaccine, the bivariant booster. Apparently it's very effective according to the companies that make it.
Yeah, when you look at the companies that make it, they'll do these tests where they look at how much neutralizing antibody does the vaccine produce, say, compared to what we knew as the old vaccine. And these do produce increased levels of neutralizing antibodies, particularly against some of those Omicron subvariants that we're looking at. So that means it's going to be a good vaccine, at least as good as the one we had, probably a little bit better. For sure will protect against severe disease. Whether it prevents you from getting COVID in the first place, jury's still out on that.
The White House announced a 6-week sprint today to try to get as many Americans as vaccinated as possible before the new year. And timing is everything a little bit with the booster. It's too late now to protect yourself for Thanksgiving, but if you're looking ahead to Christmas and the new year, what's the right timing to get the booster?
Yeah, easy answer is as soon as possible if you're not up to date on your booster. There's a few things coming together. So we've had a bit of a lull in COVID cases. I think that's reassuring folks. They haven't gotten their boosters, but as the weather gets cooler, we're starting to see that little bit of increase in COVID that we expected. But a lot of people's immune systems are probably starting to forget about COVID a little bit. It's been a while since they've been boosted, a while since they had an infection. And with all of us coming together in the cold, it'd be nice to get those boosters up to speed so that we don't see any increase in cases that we don't need to see over this winter season.
And if you're not feeling well on Thursday, stay home.
Yeah, I think this is really hard for people because we used to cheat all the time with this. Like our kids had a little sniffle, we'd send them to school.
Yeah, they'll be fine.
I don't feel that bad. It's just a little sore throat. I'm going to go to Thanksgiving. But I think now coming out of the pandemic, we realize that it's not very much fun to get any of these things, whether it's COVID or influenza or RSV. And you don't want to be that family member that comes that everyone's kind of looking at kind of sideways, being like, why are they here? And then find out that you gave everyone RSV or influenza or maybe even COVID. So if you're not feeling well, just don't chance it. Stay home, make your apologies. It's better than getting everyone sick.
And if you're hosting, just be honest with everyone.
Yeah,
exactly.
So your guidance is you just want to be transparent with your family, right?
Absolutely.
And maybe, I don't know, maybe ventilate your space a little bit. Would that help?
Yeah, so you can increase ventilation. Some people are talking about doing like a rapid COVID test before they go to Thanksgiving. Not a bad idea. And if you are, let's say, having Thanksgiving, but your company is high risk, they're older, lots of comorbid conditions, or a lot of them are unvaccinated. Certainly if you're in a county that's yellow or red on that CDC map, you may want to actually bring a mask along just to try to reduce the chance that someone makes everyone else sick.
This is what, the third Thanksgiving we talked about this, or just the second? I think it happened to you.
Yeah, I think we've had 2 bad ones. This one much better, but still talking about it.
Get vaccinated. I mean, that's the bottom line.
It helps a lot.
All right, Doctor. Happy Thanksgiving.
Happy Thanksgiving to you and your family.
Same.
We'll see you next time.